It's really a privilege to be here. And most of all, thank you to everyone for coming, because obviously if people didn't attend, there wouldn't be any program. It has been a really wonderful privilege to be in this community since I started working here. It feels like, it started yesterday, but April, what is that, like 6 months now or something like that? But it's been beautiful. I've been welcomed with open arms, and it's truly a privilege to be here. And I have the warmest feelings towards the community that I joined. So start with that. Today we're going to talk about gynecological issues, and I'm glad, as Vanessa mentioned, it was probably even harder than she mentioned to come up with a good title, because as a doctor, people come to me when they have problems, so it sounds like, being at a certain stage in our lives that it's just problems, but it's not just problems. Of course, we all have beautiful things we do in our lives every day, and we have, it's wonderful to be here, and we hope that we all live till, as many healthy, beautiful years as we can. It's not a problem, it's a privilege, it's wonderful, it's beautiful. But there are some little problems which we'll talk about, and hopefully try to emphasize ways to treat them and catch them early so that they don't become into bigger issues than they need to be. So, wait, I hit advance here? Okay. Perfect, okay. So I was gonna start with menopause, and then we'll go on to several other, 4 major subjects, and I'll touch on a couple minor things. Obviously, this forum is not gonna be a time for like a long lecture about any particular subject, just highlighting the kinds of issues that are important, and the kinds of things that women at this stage in life might need to see someone like me for, or whoever their doctor or care provider may be. So the first subject was menopause. The second is going to be pap smears, which is basically referring to screening for cervical cancer, mammograms and breast cancer awareness, and of course appropriate to this month, and urinary issues and issues of prolapse, and we'll talk more detail about each one. So I'm going to start with menopause. First of all, what does it mean? It's the time when women stop having their period, usually somewhere on average between the age of 45 and 55. So the average age is somewhere around 50. It's something it seems like a simple fact, but a lot of people don't realize that that's average. Some women come to me when they're 39 and think that all their problems are because of menopause and say, hey, you got a good 10 years to go. But that's, some of the symptoms are pretty famous. Hot flashes, night sweats, these are things that a lot of people do experience. For some women, it could be really debilitating and difficult. For some, it's just a minor nuisance. How you experience it, it doesn't, it doesn't show anything or demonstrate anything. Sometimes it runs in families, but how a person experiences it, for some people it could be terrible, for some people it could be nothing. So it really depends on you. Other things like vaginal dryness and thinning, I'm going to address that a little bit more in detail. Periods start getting a little bit irregular as you approach the time until they finally stop. And other things that I mentioned there, thinning hair, muscle aches and things. And other things that are important is some of this is a function of just age in general, and some of it is a function of menopause, and that is increased risk for osteoporosis. That's thinning of the bones, which increases risk of bone fractures. Certain types of cancers, most specifically breast and ovarian cancers, and then cardiovascular disease. So these are some of the things that are related to menopause. And then we talk about menopause treatment. So what do you do? And do I even need to be treated for menopause? And that's a discussion that needs to be had with your physician, because not necessarily does everyone need to be treated, but some people could really benefit from it. So some of it depends on how the symptoms are for you. Like with anything, is it really bad? If it's really bad, you probably want to get treated. Is it not so bad? But then on the other hand, there are other risk factors that really are not something that you necessarily experience. Like, for example, things like bone health, osteoporosis. That's not something you're going to feel every day, but it is something your doctor may be able to track and be able to talk to you about whether or not you need, depending on your particular family history, your personal medical history. So even if the symptoms aren't that bad, it's important to discuss that. And symptoms include treatments with hormones, and there's a lot of data, a lot of discussion about hormone therapy, which it's not really the place today to discuss, but for the right people, it can do a lot of good. So that's something to talk about. Other non-hormonal medications, lifestyle modifications, we'll talk about these in a minute, and some other therapies. Hormone therapies refers to two basic hormones, estrogen and progesterone. Estrogen replaces the hormones that you lost when you stopped having cycles, not lost completely, but a decreased significant. And progesterone is necessary to protect from risk of uterine cancer. And whether or not you need that, again, that needs to be discussed with your physician. And then there's non-hormonal medication. For some people, the mood symptoms might be a terrible issue, and they might need medications that are often used to manage mood disorders. Other medications to direct specifically against the hot flashes that aren't necessarily hormones, for people that the hormones might not be appropriate for, and other medications to help for the specific urinary symptoms that may occur. So those are just some examples that I put up there. In terms of lifestyle modifications, and I think you're going to find this in all the subjects that we discuss, and it's probably true about every health subject in life, that living a healthy lifestyle does make a difference. So, regular physical exercise, eating right, living a healthy lifestyle has been shown over and over again. And common sense, we know this, that living a healthy lifestyle will help. It will help even these types of symptoms. So that may be all you need. And a diet, rich in eating fruits and vegetables and whole grains and just eating a healthy diet is very important. And stress management, sometimes at this stage in our lives, you don't need me to tell you this, but the stress never goes away from our lives. We think it's going to get better one day. Well, I think you could many of you could teach me even more than I can teach you, but I'm sure we know it doesn't get better. If you expect it to go away, it won't go away. We may hopefully learn, though, as we age, how to handle it better and how to appreciate each moment and how to get through our life stress. But learning ways to deal with these things may be all that's necessary, or may be necessary together with these treatments. So it's very important, because that stage in life is the stage when if our parents, if we have them, are getting older, our relatives are getting older, our children, may be going through all kinds of difficulties. So it builds up, and dealing with that is important. Other therapies, one of the problems that doesn't get talked about much is vaginal symptoms like dryness and atrophy, which can cause a lot of discomfort. There are definitely medications, creams, and stuff that you need to talk to your physician about that can help. One of the key things that's really important to remember from this, the first one key thing was that lifestyle matters. The second key thing is that if something bothers you, you don't have to suffer. There's so many times I meet people that say, this has been bothering me for years. And you say, well, why didn't you see anyone? Why didn't you talk to me? And they'll say, well, I just thought it's just part of getting old. Well, there are parts of getting old that is that way. But if something is bothering you, don't just assume that. There may be relief. Maybe it may not take it away completely, but it may make it better. Don't suffer in silence. You're not going to get extra points for doing that. We have enough suffering that we can't avoid. If there's things that we can help, then speak to your physician. There may be something that may help. And other things, there's other therapies out there, whether they're, how you find them, acupuncture, hypnotherapy, all kinds of things that can help with stresses and help with some of these things. And there's pretty good scientific evidence that a lot of these things help a lot of women get through those stresses. So I wouldn't, push them away. The key points, again, healthy lifestyle. And another point that I wanted to mention is that any bleeding after menopause, I can say this till my face is blue, but this is really, really important. Don't just assume, oh, it's nothing, oh, my sister said she had it, or my cousin said she had it, or my mom. Don't, if you went through menopause, once 6 months goes by, and you're in that age set where it's menopause, and if you have any bleeding again, it could be a sign of something bad. So it's very important to have that evaluated. Most of the time, it's nothing, but don't hang your hat on the fact that it's just most of the time, because it can be serious, and make sure it's evaluated. So please don't let that go. I mean, I see this often. And that there are treatments available, so don't just suffer in silence and see your physician. Those are the key points I wanted to talk to you about menopause. The next subject I wanted to talk about was screening for cervical cancer, and that's what most women know as their annual pap smear. As some of you, all of you probably know that pap smears are one of the most important advances in modern medicine. Cervical cancer used to be one of the most common cancers from which women died in this country until the pap smear was developed about, I don't know, 60, 70 years ago. But nowadays we've actually tweaked it so that we're so much better at screening that we don't, in most cases, need to do pap smears every year anymore. The caveat is that you need to talk to your doctor and find out if you're one of the exceptions, because there still are some women that need it. Most women, if you've had normal pap smears your whole life, then most women will not need pap smears anymore at all after the age of 65. Remember, I said most. There are some exceptions to the rule, so you need to talk to your physician and find out if you're in that group. But just remember that, and even prior to 65, nowadays, most women, because our pap smears have gotten more accurate and we test for the HPV virus, and we do a lot more than we used to in the older pap smears, most women, even before 65, don't need it every year anymore. For most people, it's either every 3 years or even sometimes every 5 years. So to go through all the different recommendations now would be too complicated, but it's important for each of you to know. Many of you may already know, but if you don't, speak to your physician and find out. But but if it's been 10 years since you've had this talk, please see a doctor, because you probably do need one. So it's really, really important to do that. In cases where you've had a history of problems with your pap smears, then definitely make sure you see your physician. And don't let that go away, because time is of the essence. With any cancer, it's true, the longer you wait, the more dangerous it can get. Third subject I wanted to talk about was mammograms and breast cancer. Obviously appropriate for this month, but it's appropriate for every month. The recommendations, there's like 4 or 5 different societies: the American College of Obstetricians and Gynecologists, the Society for Preventive Medicine, and the American Radiology. They each one have slightly different recommendations, but what here I'm kind of melted them down into a simple thing to remember. Once you hit the age 40, everyone recommends regular mammographic screening. Some say 1 year, some say 2 years, so that's why I wrote 1 to 2 years, all right? So on a regular basis, every woman, even if she's low risk for cancer, and some of those risk factors I'm going to talk about in a minute, they're at the bottom of this slide. After 75, there are many women that may not need mammograms anymore, but again, that needs to be discussed with your physician, because it depends on your specific history. Which is before the age 40 also. For an average woman who's low risk doesn't need regular screening, but some women do if they have increased risk factors. So again, that needs to be discussed with your physician. But between 40 and 75 on a regular basis, every 1 to 2 years, even people that are at low risk. Some of the things you want to look for are, the truth is that I would say the easiest thing to remember, if you want to remember one thing, it's something different. You know your own body better than anyone else does. If something's changed, that's when you should be concerned. The types of changes are usually lumps or bumps that weren't there before, maybe a sensation of tightness or pain or discomfort with certain movements. Skin changes where it just doesn't look right, it doesn't look the same as it used to, it's a little dimpled, maybe some rash on the skin. Any discharge from the nipple, if you're not breastfeeding, there shouldn't be any discharge. So if anything, whether it's bleeding or anything like that, these are things you should look at. Pain, tenderness is usually not the way breast cancer presents. So, but obviously if there's pain, definitely see the physician, but any one of those changes. So the bottom line is, if you don't want to remember all those details, just remember, if something's different, get it checked out. And that's in addition to the routine screening. Some of the risks, age is a risk. Pretty much all cancers, as we get older, the risks increase. Genetics, so if you know that you happen to be a carrier of one of the identified genes that increases your risk for breast cancer. If you don't know, you may want to talk to your physician about whether testing is appropriate for you or not. If you know there's a family history, if you know your sister or a close relative, mom or whatever, had breast cancer, that puts you at higher risk. Obesity, being overweight, alcohol, smoking, lack of exercise have all been shown to increase the risk. This goes back to what I started. A healthy lifestyle makes a big difference in a lot of things, including breast cancer, which is something a lot of people don't know or realize. So there are things you can do to help reduce your risk for breast cancer. Now, the fourth category I was going to go into is issues that I have pretty frequently is issues of prolapse. And what prolapse means is something's falling that's not supposed to be. Something's dropping. And usually that happens when your pelvis has been through some sort of a trauma. So that the trauma that can happen could have been pregnancies, and sometimes you may have had those pregnancies, especially if they were traumatic. Maybe you had a really big baby, maybe that baby was delivered by forceps, maybe there was a large injury when you had the baby. And when you're younger, you may not feel the symptoms, but maybe 15, 20, 30 years later, it might be when it comes back to get you. It's pretty complex, and it could also manifest itself in urine incontinence and urinary issues. I mentioned here there's different types of urine incontinence. It could be neurologic, which we usually call urge, and it usually involves more of a sensation of needing to urinate and leaking. Stress is referring to physical stress on the body, like I mentioned before. The other things that can do that are obesity, having had surgery on your pelvis before, so anything that traumatizes the pelvis, something that causes if you have another illness that causes chronic constipation, so you're always pushing downwards, so those kinds of things can make those kinds of problems worse. There are medications that can sometimes help. There are exercises, which I did not mention there, but there are exercises that can help. And then sometimes surgery, sometimes there's devices called pessaries that can help support the pelvis. So there are things that can be done. Don't suffer in silence. You know, this is one of the big things that I find many women coming to me and, you know, after many years of suffering, just assuming that's just the way it is. You know, it may be true, but most of the time there's something that can help at least alleviate the symptoms, so remember that. So those are really the four major subjects I wanted to discuss. I talked about prolapse. There's a lot of different types of prolapse. We talked about the risk factors, and I'm going to open the floor to questions. And you know, these kinds of issues, you know, if you feel comfortable asking, I feel comfortable answering. Some of these things obviously are much more appropriate for private conversations, which is understandable. That's just the nature of the way it is, and all of medicine is the truth. But definitely, please go ahead and ask away if you have anything or comments or whatever.
Okay, guys, do you have some questions that you want to ask?
I see someone that wants to.
Yeah, go ahead.
What if you urinate a lot?
Yeah, so that would kind of, that's like, there's different names that can be called, like overactive bladder, or, so it may or may not be included in incontinence, because you may or may not leak. So, but it is a problem that can happen, and it's definitely something we could talk about, you know, in the right context.
Yes.
Yes, but it's a common problem as well. Usually it's neurologic in origin, but it could also be infectious, like there could be urine infections that cause that. But usually it's treatable. Yes?
Sure.
How do you treat the vaginal prolapse?
It really depends. Depends on how severe it is and what type of prolapse it is. But there are, sometimes it can be treated with exercises, sometimes there are creams that can be used. There are pessaries that are devices that are designed to put in the vagina that hold it in the right way, and occasionally surgery is done. And there's a lot of different kind of levels of surgery, so that there are ways to fix it. If it doesn't cause you any symptoms, like if it really doesn't bother you, then it's usually best just to leave it alone. But if it bothers you enough to seek care, then that usually means we need to do something about it. So there is some truth to what people say, oh, that's just part of getting older. But that's only true to the extent that you're living with it and it's not affecting your life. But if it's affecting your life, then you should probably at least, you know, talk to your doctor and see if there's something that might be able to help.
Those are great questions. Anyone else have a question? That you're brave enough to ask? Is that what you're thinking?
I think the nature of the subject is such that would rather not, which is totally understandable. But Vanessa told you guys where I am. We have cards that we can give out.
Yes, everybody has a card.
So if you want to call me, or see whichever physician or any care provider that you see already, just make sure you get taken care of and don't just let it float, because it's not going to get better by itself.
I want to thank you for being so much. Yes. See, it's so common for him to talk about it, but I do understand the sensitivity of the subject for sure. But be sure, everybody should have a card. Please feel free to call, make an appointment. I will say this, Dr. Weinreb and I have not known each other long because he hasn't been here long, but I will tell you this, he has a real passion, and hopefully you felt that today, for taking care of women and their health needs and delivering babies. So you can spread that around too. But just women's health care. So please talk to friends, neighbors, Sunday school class, and let people know that he's here and ready to serve and take care of our community, because earlier I said he lives right here. It just worked out. So anyway, we're going to close today. I'm going to ask Rosa to come, and we're going to show you a little clip to remind you just how important those memos are. But before Dr. Weinreb steps away, let's give him a big hand for being and being brave. Yes, ma'am.
An answer about hormone therapy. What age range should you be in when you take that?
So when you pass through menopause, so it really depends on your own body. Like when your body stops making those hormones, that's when you want to talk to your doctor about whether it's appropriate for you to start taking them.
Well, some of my older friends have been taking the estrogen still, and they're not having the bone problems.
Yeah, well, the estrogen helps with the bone problems. And there is a point, and we think it's about 10 years from menopause, that after if you did not take estrogen, after 10 years, the current evidence seems to pretty strongly indicate that it's probably not a good idea to then start it.
Okay, so
but if you've been on it since then exactly how long you should stay on it is an open question. But for most women, it's pretty long term.
Okay.
Does that answer?
Yeah, because like I said, my friends now, I'm having bone problems. And they're like, well, we kept on with the estrogen and, I quit.
Right. Well, obviously, I can't comment on your history because I don't know it. But it's definitely true that being on estrogen helps the bones. And that's one of the reasons why many women take it. Whether or not there's other appropriate options for you, we can talk about that in the proper context. But, does that make sense?
Yeah, great question. Anybody else? It's just beating in your heart, but you just can't get there. Well, Dr. Weinreb will be here for a little bit before he gets back to the office after we complete the program. But as I turn it over to Rosa to talk about the next little video, I always leave you this challenge in October. Is it you? Is it your sister? Is it your friend? Is it your neighbor? Is it the person who in your life, your daughter, who hasn't had their memo? Pick up the phone today and call, because you could save their life. You could save their life. And Coosa Valley Medical Center, we are so proud of our memo services and what we have to offer. I'll tell you this, we have the best of the best staff, the best equipment, the best everything. So I can truly look at you as my friend and just be so proud. You can take care of it right here at home. So pick up the phone, call that friend, that daughter, whoever that is, today, not tomorrow, but today, and say, hey, when's the last time you had your memo? That's my plea to you today. And with that, I'm going to pass it over to Rosa and show you a little video clip.
Thank you. As Vanessa said, I'm Rosa, the director of the Coosa Valley Medical Center Foundation, and I hope that you took away some good nuggets from what Dr. Weinreb and Vanessa had said. I want to echo the point that as women, sometimes, especially mothers, we put ourselves last. I've only been a mother for a year, but I quickly learned that, and I just say, if you know somebody who maybe hasn't gotten their annual mammo, if you haven't gone to the doctor long and to get it, maybe fear is stopping you, maybe you're afraid of the pain. Our video is going to talk about that a little bit, about the services that we have at Coosa Valley Medical Center. But I would encourage you to put yourself first, go speak to your doctor and get your mammo if you need to have a mammo done.
Hi, I'm Kelly Cates, and this is my grateful patient story. My breast cancer journey began when I found a lump in my breast. I had had a mammogram years ago. I remember that it was very, very painful, so I feared getting a mammogram. But I learned at Coosa Valley Medical Center they have the 3D mammogram machine, which is the same technology that they have at much larger hospitals. So I came in for the mammogram. It was not painful at all. So that mammogram led to my diagnosis of breast cancer, and I realized how important it is that I receive my mammogram yearly. If you're concerned about pain or worried about discomfort, please don't let that stop you from having your annual check. At Coosa Valley Medical Center, they make the process easy and comfortable. Coosa Valley Medical Center was with me throughout every step of the process. In the operating room, I had my biopsy, I had my port placed, later I had my mastectomy. In the ICU, the staff there made me feel comfortable, safe, and reassured me that they were going to take care of me. Even on the women's unit, I received a blood transfusion, and through every unit of the hospital that I was at, they all gave me friendly and compassionate care. Most of my time was spent at hematology and oncology. Staff there made me feel like family. They made me feel welcome. They knew me by name. They truly helped me get through this journey. The people were so friendly and so nice, from the housekeeping department to registration, to the OR, to radiology, the surgery team, the ICU. From top to bottom, everybody was so nice. I'm so thankful that we have this kind of care close to home. If Coosa Valley Medical Center has touched your life like it has mine, please consider supporting the Grateful Patient Program. Your gift ensures that women undergoing this battle can receive quality care close to home. Thank you, Coosa Valley Medical Center, for being a part of my journey.
Yes, Kelly has a wonderful story, and she's just such a great patient. She's been through Coosa Valley Medical Center every step of her journey. And so as a point to that, we would encourage you, if you're in any point of your health journey, please come see us at Coosa Valley Medical Center, whether that's through Dr. Weinreb, any of our other providers. We'd love to see you and have you be one of our patients. So with that, we hope that you had fun today with your hats, your goodies, your skirts, your bows.